Thank you for joining us. And without any further ado, I'm super excited to introduce you to tonight's experts, Dr. Olga Abiri. She is the director of the Women's Hospital at Jackson Memorial, and she has an extensive background in women and children's health for over 20 years in Miami-Dade and Broward counties. So even specific to our area, she has this expertise, and she holds a master's in nursing leadership and a Doctor of Philosophy degree with a research focus on safety in perinatal arena. So this is really her wheelhouse. She holds national certifications in maternal newborn care and electronic fetal monitoring. So Dr. Abiri, welcome. We're so glad you're here.
Good evening. I'm very happy to be here.
Yes, thank you for joining us. And then I'll introduce you to our second expert, Dr. Sharon Burbello. She's with us and has been the Maternal Fetal Medicine Liaison for Jackson Health System for 4 years. She passed her RN board soon after graduating from Marymount College. Remind me where Marymount is. I've heard of it. Remind me.
Arlington, Virginia.
Okay, I thought it was up the East Coast. Okay, Arlington, Virginia.
Yeah.
Awesome. And she received her master's degree and her Ph.D. from the College of Nursing at the University of Rhode Island. Yeah. And over her 45-year career, she's had the privilege of working with families from across the world, giving her amazing diverse experience. And as a maternal family health liaison at the Women's Hospital at Jackson, she provides education to new families and specializes in areas such as newborn safety and safe sleep. So here we are. This is our topic tonight. I think we have the two best, most qualified women to teach us, and we're so excited. I have 3 small children, 1 on the way, and so I think, man, this topic, you kind of think,
exciting.
I know I've had other babies, but it is always good to be refreshed, and things are constantly changing, so to stay up to date. So we're going to do that tonight. So let's just start kind of where we all, I think, first go when we think of safe sleep. I immediately think of SIDS. And so I'm like, okay, talk to us about what is SIDS.
All right, so SIDS stands for Sudden Infant Death Syndrome, and it happens before the baby turns 1 year old. And actually, there is also a different abbreviation, which is SUID, which stands for Sudden, Unexpected, or Unexplained Infant Death. SIDS, unlike the SUID, usually diagnosis of exclusion. So when everything is ruled out, when medical history is ruled out, where there's no accidents identified, then it's called SIDS. However, SUID, it stands for other unexpected, death that happens in the infants under 1 year of age.
Okay, yeah, thanks for clarifying that, because I think I hear SIDS a lot, but I haven't heard the SUID, but I see the difference now. So thank you for clarifying that. What is the best way, I know you said up until that first year, what is the best way to reduce a baby's risk for SIDS?
The best way to reduce the risk for SIDS and to put their babies back to sleep. While they go to sleep, just place them on their back. Most of the incidents of SIDS are happening during the baby's sleep. And also there are risk factors that may be associated with risk, such as mother smoking, mom using alcohol or illicit drugs, and mom who does not get prenatal care, to identify the risks that, possibly can impact, infants' health. Babies who are born prematurely, they're at high risk. Also, if there's a family history of SIDS, if it's already happened in that family, somebody needs to be more cautious and conscious about that. Mothers, young mothers who might not know about all the risks, and if the babies get overheated.
Yeah, that's good. I love the certain sleep sack, I guess, that we have used with my babies. It even says on there, like, back is best. And I love that because it's like a mental, in your face reminder, because there's so many times, you're waking up in the night, you're breastfeeding, you're tired, there's so much going on. And to just have that visual reminder, and I'm always thinking, like, back is best, back is best. So I love hearing those tips. So good. What about, you put your baby on their back to sleep, then they have the concern, like, well, can my baby choke if they're laying on their back? Is that a risk?
Well, primarily what you're thinking about when you're talking about back to sleep is a firm surface. So when we talk to parents about purchasing a place where your baby's going to sleep, we always advise that they buy the mattress that goes with the bassinet or the mattress that goes with the crib. And again, it's a firm, flat surface. So anatomically, if a baby is laying on its back, and note that a recent article by the American Academy of Pediatrics said there have not been any documented cases of babies laying on their back that suffocated as a result of that position, because what happens is the trachea and the esophagus is where the food passes through, and the trachea is where you're breathing. Right. They're next to each other, but you'd have to go against the gradient to actually have something come up from the stomach through the esophagus and then go into the trachea.
You have to come out and back in.
Yes.
Gotcha.
But if you're laying on your stomach, it could get caught there and actually interfere with the breathing.
Wow.
So we've been able to talk to parents here at Jackson. We are a safe sleep certified hospital. Okay. And Olga and I have worked closely together to maintain that certification, as well as our other leadership, to be sure that everything is in place. And that requires that we talk with parents before they're discharged about safe sleep. And that's one of the big questions parents will say to me: what if the baby spits up? And so then we gently explain that to them, and then we actually have pictures that we show moms, and often other family members that are asking questions. And once they understand that, okay, I get that, it makes it a little bit easier.
That's helpful. Just even how you explain the two, I'm not a doctor, I don't know how it all works, but hearing you say it even like that, I'm like, okay, so somebody have to come all the way out and back in down the right hole, and that's a little complicated. Right. So that's encouraging. That's great. Times have changed. And so I think about, when I was raised, and now my mom is the abuela, she's taking care of the baby and helping, and like, oh, but he loves to sleep with a little rag by his face. And I'm like, don't put anything near him, or when you were a baby, you slept on your stomach, was that wrong? And I mean, talk to us about that now. And it's, you're dealing with family dynamics there too. So talk to us about that.
Want that, Olga?
Sure.
Yeah, go ahead.
So at that time, the caregivers were following the advice that was available on the evidence that was available at that time. Right. But, time goes by and research change, and the current research does show that sleeping on the stomach increases the risk for SIDS. And the research does show that the sleeping on the back is the lowest risk for SIDS. So that's why recommendation is back to sleep.
Yeah, that's great.
That's why you have to share with all the caregivers of your child the latest recommendations and what the research shows, and the moms and the dads, they lay down the expectations for who's caring for their child, and say, no, now babies sleep on their back. And when they're sleeping on their back, I have a picture. The coalition developed this.
Oh, that's great.
I don't know if everybody can see it. Babies are on their back, and there's nothing in the crib or the bassinet but the baby. Right. I always say no pillows, no blankets, no stuffed animals, no other animals, because that leads to that whole other conversation about safety in pets. And if you're a cat person, they're going to find their way, and, having all those discussions. But you need to make sure that people that are caring for your children are aware of what's expected.
That's great. That's great. I want to say too, to our guests who are listening tonight, if at any moment, we've got lots of questions we're going to put before our experts, but if we're talking and you think of something that you really have a question about, you can utilize that Q&A feature at the bottom of your screen, and I will do my best to get all of those questions here in front of our experts. But if you have a particular question that we haven't addressed, please drop that in the Q&A box. But moving along, let's talk about swaddling. And does swaddling our babies reduce the risk of SIDS?
Well, if Olga doesn't mind, I'll take that, because here at Jackson, we provide our families with an actual swaddler sleep sack.
Oh, wow.
And how am I doing with holding this up?
Great.
You see that it's
a little bit higher, we get the whole thing, but that looks great.
Yep. And it has our logo on it. And it's a great teaching moment when babies have their first baths and parents are there, and the nurses going over the important things that we go over. We include our conversation about safe sleep. When the bath is completed, the baby is then going to wear the Halo sleep sack.
Great.
And we can explain it to parents that swaddling in the blankets is fine as long as you're awake, you're alert, you're with your baby. It's easier to hold a baby that's swaddled. But when the babies are sleeping and you're sleeping, this is a much safer situation, the sleep sacks.
Yeah,
and we talk about
Houdini babies that pop out of those.
Right, and some babies like to put their hands out because they've spent 10 months in utero sucking their fingers, etc., and they miss that. And so we talk about how that's okay. But the sleep sacks are a big conversation here. Every family leaves with one, and we've enjoyed teaching the parents that, and we hear from them that it's turned to be a good thing too.
Yes, and actually there's no evidence that swaddling reduces the risk. However, if the baby is swaddled and placed on the stomach, the swaddling can even increase the risk for SIDS. So if you decide to swaddle your baby, just make sure that the baby is on the back.
Always on the back. That's great.
Always on the back.
Thank you for sharing. And I love that you guys do that with the swaddles. That's amazing. Let's talk about skin to skin. You know, it's so important. But is that something, you know, it feels like it can be dangerous. And then as soon as the baby's born, is that a great thing to do immediately?
Actually, experts recommend to skin right after the baby's birth and for at least 1 hour. You know, skin to skin can be done with mom, skin to skin can be done also with dad. And, you know, once mom is stable and awake and can take care of her baby, you know, skin to skin is definitely recommended. However, when skin to skin is done and it's time for baby to go to sleep, again, the baby needs to be sleeping in the bassinet on the back.
Yes, great. Is there a time that's appropriate for a baby to be on their stomach?
Well, it's very important for a baby to be on the stomach. That's how babies develop their neck muscles and back muscles, but it should be done when the baby is awake.
Yeah. And what's a good time? Forgive me, I have 3 kids. I should know this, but it just shows we just kind of start fresh every time. But when is that tummy time starting? I mean, we're not like day 1, let's practice tummy time. But when do we find that that's a good, I mean, and maybe that's a pediatrician question, but when's a good time to be thinking about starting that?
Well, once you're home and the cord has, you know, the clamp's been removed in the hospital, the cord has fallen off, that's usually 7 to 10 days. That's a fine time to start it. But some parents will even start earlier. Yeah. And that's perfect. It's fine. It's appropriate as long as you're with your child, you're sitting, I suggest on the ground using the little play mats, you're sitting next to the baby, baby's head is turned to the side. They enjoy it soon, and it prevents the head from getting flat, which many of us have seen that happen. And it's just good overall for digestion and the baby, as Olga said, learning to lift its head eventually and stretch its muscles. It's a good thing. The recommendation, and I finally looked it up in one of the books because parents like numbers and specifics. It said 3 times a day once you start it for 5 to 10 minutes. Okay. Yeah. So getting in a little rhythm, right, to give them that time is good, but always right there with them, eyes on them, because man, it just takes a second. This is so good and so many good reminders. What about, okay, back is best. I hear that, I know that, but our baby's having a hard time, like getting used to sleeping on their back, and like you're so tired and you're just looking for solutions to get the baby to rest. Any encouragement or strategies for if a baby is struggling to be comfortable on their back? Well, start with good, I mean, here I sit saying this, start with good practices right from the beginning with children, right? Yeah. It's so hard to backpedal when you don't do things right in the beginning, but your baby doesn't know any better. If you're putting your baby to sleep on its back all the time, they learn to get comfortable and to enjoy that. one of the things parents get anxious about is that day where you walk into the baby's room. If the baby's not sleeping in the room with you, they're 3 or 4 months old, and they're laying on their stomach, and you put them to sleep on their back. Right. And parents get very frantic, and I've had questions, how can we secure them? And we say, you can't. Every time you put your baby to sleep, put them to sleep on their back, and it's recommended all the way up to 1 year.
Yeah.
And great. Then when they're rolling and turning over onto their stomach, that's what they're doing, and that isn't anything that you're going to change. You're just going to repeat the behavior of putting them on their back next time they go to sleep.
That's good. Yes, they're learning that skill. That's good.
And also, we frequently have this misperception that, the babies don't sleep well if we place them on the back. It's normal for the baby to wake up a lot, especially if it's a breastfeeding baby. It's physiologically normal. So in the beginning, babies do need to wake up a lot and do need to have, their feedings on time. So if they wake up on their back, it does not necessarily mean that they're not comfortable. It's just, the way it's supposed to be.
Yeah, that's good. That's so good. Okay, let's see. Okay, this is a question that we received. I saw a product that said it could prevent SIDS and keep your baby in the right position during sleep. I think I know the answer to this, but you tell us, can we prevent SIDS? Can we use it to prevent SIDS?
As far as SIDS, when the death is unknown from unknown reason, there's really not currently any way to prevent it. However, there are many ways to prevent the SUID, the sudden unexplained infant death. And as far as products, you need to be very careful when you buy products, because sometimes the product that state that they may be, may reduce SIDS, they actually can contribute to the SIDS, such as wedges, to support babies, to sleep on their side. Sleeping on the side is not recommended. Sleeping on the back is the safest way. So if you do choose to purchase any of the product, you really need to do a good research whether this is really something that will assist you to prevent SIDS and not to contribute to it as a risk factor.
I will say marketing for baby gadgets is really strong. Yep. And just because it has a commercial or a big campaign behind it doesn't always mean that it's recommended or that it's safe. So I love that you're encouraging people to do their research and really look into those things before you make those purchases. And just if it's the hot new whatever, it doesn't mean it needs to be on your registry. I've definitely learned that. That's good. That's a good tip. Okay, you mentioned this a little bit about as babies start to roll. And I'll never forget, the first time the baby rolls, you think, oh, but at that point, if a baby rolls onto his or her stomach during their sleep, should we get up and go roll them back, or what do you suggest there?
Are you sleeping and you wake up, or you happen to check on them and now they're laying on their stomach?
Right.
Yes, if you can gently put them back on their back, yes. Yeah. But again, there's no need to stay up and watch them, or if they're doing that already, their strength, that's what they're doing. Okay, you take care of all the other things. You have a firm surface, nothing else in the crib, baby's up to date on immunizations, you're still exclusively breastfeeding. All those other things play a huge part in this.
That's great. That's right. I'd love to know from our audience, I'm calling for some audience participation here if you're willing, but I would love to know, are you a caregiver? Are you a parent? And what is the age of your child? Or are you expecting? It's always kind of fun to know, where people are. So if you're willing to share, we'd love to hear, who kind of we're speaking specifically to. That helps us to also direct our questions. So love that. Love knowing who we're speaking directly to. But let's talk a little bit about, you mentioned this, Dr. Burbello and Dr. Abeeri as well, but the flat spots. We talk about a lot of time on their back, and will our babies get flat spots on the back of their head from sleeping on their back, from being on their back too much, and how can we remedy that?
So the pressure on the same part of the baby's head can cause flat spots if babies are laid down in the same position too often or stay for too long of a time. But such flat spots are usually not dangerous and typically go away on their own, once the baby starts sitting up and being more active.
Yeah.
The flat spots are usually not linked to the long-term problems, with the shape of the head in the adulthood. And, making sure that the baby gets enough tummy time and, being carried around when the baby is awake should prevent, flat spots from forming.
That's good.
Parents should be careful not to let the baby sleep in, like, when you know how you bring the car seat in and you got things here and the car seat here, and you should put the baby, and then it's okay to put your other things down and do a couple of things because the baby's sleeping, but then you should go back to the baby, take them out of the car seat, put them flat if it's really sleep time.
Yeah.
If they're in the swing that's appropriate for their age and they fall asleep, you should be taking them out, again, putting them flat. I know I'm speaking, and doing the right thing, which is what we always do. Moms are tired.
Yeah.
And, a few minutes of letting the baby sleep with your eye on them while you're putting your things down, that's okay. But no longer than that, because they're not designed for sleeping.
Yeah.
And again, as far as the flat part of the head goes, you're putting the baby flat down in a crib. But some of the research shows that even though it's the same mattress, if you move the baby around in the mattress, so we tend to go into the room and put the baby down facing the same way all the time, because the mobile's over here and the window's over here and the diffuser's over here. But if you can get yourself into the habit of moving the baby maybe totally the opposite way around a bit in the crib, it does make a difference according to the research.
That's
as far as not letting the head be flat.
Yeah, I'm thinking I have a 15-month-old and I still lay him down exactly. There's probably a dent in the bed from like where he's laid. So that's a good tip. Wow, I love seeing in the comments so many expectant mamas.
Oh,
I love that, and first-time mamas. So I just commend you for doing your research, for joining us tonight, for just eating up all that you can. And I'm so excited for you because I want you all to go back to jacksonevents.org later and look up and read all the other topics, because there's so many other topics that will be relevant and encouraging for you. But just commend all of you. We've got some March babies coming. So, I mean, some mamas are 2 weeks out. So I love that. And just so glad that y'all are here. Such an important topic. Okay, let's talk about breastfeeding and just safety in general. I feel like there's a lot here. We could camp here for a bit. How are we going to breastfeed our baby if they don't sleep with us? Or, I mean, even worse, sometimes, like you said, we're tired. You're more tired than you ever are in your whole life. And you think, I will never fall asleep while I'm breastfeeding my baby. And then, you kind of wake up and you don't know, how long was that sleep, and those scary thoughts. It's happened to me. And I think, oh my goodness, I could have dropped the baby. I could have rolled over. So give us some safe tips on breastfeeding our babies in the night, keeping our children separate and in a safe sleep space.
It's an important topic. We are an exclusive breastfeeding hospital. We're a baby-friendly hospital, and Olga leads us in maintaining that designation. And that's a big topic with moms. Many times they will say, I want to breastfeed so I don't have to get up at night. So then we go over what you're just bringing up, the fact that you don't want to breastfeed in a place that you're going to fall asleep.
That's right.
And we always are looking at evidence-based practice here. And most of the recorded infant deaths that are due to sleep positions are caused during breastfeeding or laying on a couch with a baby. Those are the situations that we're talking about. So we'll tell moms that if you're thinking about the nighttime breastfeeding, get a rocking chair or another comfortable chair next to your bed, get up, feed your baby, put your baby back to sleep in a safe position, and then get back in bed. Because you probably remember with the baby your age now, how when you're breastfeeding, you get this sense of contentment. When your baby's enjoying the feeding, you're comfortable, you're relaxed, and boy, it's easy to fall asleep yourself, isn't it? Right.
Yeah. Oh, yeah.
And that's a real problem. So we suggest that breastfeeding is not done in any reclining position like that if there's a chance that you're going to be going to sleep. While safe sleep positions is the #1 variable that helps decrease the number of SIDS, breastfeeding is the #2. Exclusive breastfeeding provides your baby with amazing opportunities and prevents a lot of issues. And one of them is the major issue of SIDS. Again, we don't know the cause of it, but we know that all these variables that we're working on have the lowest numbers. I believe Olga will be able to share those with you, that we've ever had in the United States, because we're putting our babies back to sleep. We're breastfeeding, we're immunizing, we're not smoking, and our moms are healthier.
Great.
Yeah.
And staying educated. This is so good. Wonderful. Anything you would add, Dr. Abeeri, to that? I mean, you covered it, Dr. Burbello.
Yeah, Dr. Burbello really did amazing job. And, you know, it is important to have the baby in the room with you so you can hear your baby, all the cues when the baby is waking up for breastfeeding, but not in the bed.
Yeah, that's great. I have a question, and we alluded to it a little bit earlier, but about the car seat, because I think especially in, you know, baby's early life, and if you're on the go, they're just napping so much that they fall asleep in the car seat. Are there any things to be aware of or to be doing to provide the safest sleep when we're on the go?
Well, babies should not be sleeping permanently in the car seat. I know that, you know, and I'm a parent myself, and I know that many children really do good when we put them in the car seat and start them driving around, and they just have a great sleep. However, it should not be used as means for baby sleep. It's only to take baby from one place to another.
Yeah, that's good. Good, great.
And don't use anything in the car seat. That's a big thing.
Yeah.
We require, and for you moms to be that are going to be delivering your babies with us here, we can't wait to meet you. One of the things that we ask is that you have the car seat in the room before you're discharged.
That's great.
And often I will see families take blankets and inserts and things that they buy to keep the baby secure in the car seat. And that's not recommended. Again, we're very careful about providing education and not saying, oh, you're doing it wrong. Instead, we remind parents, if it doesn't come with the car seat when you buy it, you don't need it. And you don't need to pack a blanket around the baby's head to keep it straight. What you need to learn is how to secure the baby in the car seat by getting the straps correct and being sure that your baby's secured correctly.
That's right. That's right. I'm giving myself away a little bit here, but no pride in being a third-time mom. But my first baby, we had the car seat, and you know, you've done the registry, you've got the pink or blue blanket with you to send them home, the outfit, all that. It's time to send them home and put them in the car seat. And we're like, okay. And we couldn't figure out how do we, it's too tight. How do I loosen it? And I think of all the things we did to prepare, we did not prepare to know how to utilize the car seat, you know, very confidently. So learn from my mistake, and all of you first-time mamas know how to work and maneuver that car seat, because that is just such a safety concern. So I love, and in the hospitals, I assume it's the same at Jackson, but you know, they can't help, you know, we're not supposed to help. Like, you know, you need to know how to do this. And so,
and it can be very, parents get very anxious. So we ask them to practice. I usually say, you know, get it all out, get us a little stuffed animal, figure out how to use all that. And then we let everybody know that here at Jackson Hospital, there is the opportunity to make an appointment at the Mailman Center, and they will free of charge give you an appointment, come out to the curb and meet you and help you install the car seat safely.
That is so awesome.
Yeah. Or you can call your police station or fire department. And we always recommend that they do that, because there's a lot to learn about car seats.
That's right. That's
frustrating.
That is great. Thank you all for.
Also in the hospitals, you know, we do have the car seat testing policy for babies who were born a little bit prematurely or low birth weight, that we really attach babies to the pulse oximetry, and we count their respirations, you know, with the monitor, just making sure that, you know, babies can breathe and their oxygen saturation in blood is being maintained.
That's great. And to our audience who are listening in, while you're listening, I'd love for you to think, and if you're willing to share, but like, what are the concerns maybe that you come with of like, we all have fears associated with trying new things, with doing new things, and parenthood is certainly doesn't come with a perfect manual, which is why we have these resources for you. But are there certain things that make you nervous about your sleep, your baby's sleep in these first kind of months? Because we want to help encourage you in that. So if there's anything that we can speak directly to, please let us know. I'd love seeing that Julene, forgive me if I'm saying her name wrong, but as a nurse educator, she's here to learn how she can inform new moms how to take care of themselves and their babies and have a healthy pregnancy. So just love that you guys are here to learn. Talk to us about why do we need to get a crib or a bassinet for a baby to sleep? Kind of think, of course we need a crib, but why it's so important?
Because actually statistics do show that majority of sleep-related deaths occur when baby is not sleeping in the crib or in the bassinet.
Yeah.
So cribs and bassinets are the safest place for the baby to sleep. The baby should not be sleeping on the couch, should not be sleeping on the pillow, on the cushion or any stuffed animals around. So we really need the secure space that, crib or bassinet will provide. And again, making sure that it does not have any loose bedding, any stuffed animals or anything in it.
That's good. And I know we've got a lot of first-time moms here listening, but I know even just like you were guys saying, just continually check the latest recommendations and any product recalls, because I know products that I used with my first baby that were considered safe have now been, discontinued and said they are not safe. So to stay up to date on those things is so important. But crib, bassinet, number one place for baby. Sometimes people are concerned with, okay, we put them in the crib, don't put anything in there, but is my baby going to be cold without a blanket? Or are they going to be cold without a lovey next to them? Talk to us about that.
The recommendation is your baby, and I'm from New England, so living here in Florida now, most people are talking to me about the air conditioning. Mm-hmm. And we had the heat at home that we were always worrying about. But the recommendation is that your child should have one more layer on than you're wearing. So if you have a light jacket on because your house is a little cool, they should have something a little bit heavier. Right. So you're talking about the diaper, the t-shirt, the zip up onesie, mm-hmm. and then they're in a sleep sack.
That's good. That's
okay.
Good. One of the questions we received on that note is, how do I know what's hot or what's cold for my baby? And that's a good gauge to know how I feel. Is there a way to, I'm a naturally cold person, so I'm naturally cold and my husband's burning up. So is my baby hot or cold? What's a good way to discern that?
You can always take baby's temperature, because babies are small, so they lose temperature and gain temperature very quickly. So just making sure that the temperature within the normal range.
Yeah, that's great. That's good.
And we can always touch, the hands and the feet to make sure that they're not cold.
Yeah. That's good. On the note of crib versus bassinet, talk to us about pack and play. Is that a safe option? And then later moving on to a crib, I've seen, there's the pack and plays, and then they make them with like the infant things on top. Are those the safe solution, I guess, for sleep?
They are safe. Talking about the piece on top, the baby that can be a bassinet. Again, your mindset is always, is this a firm surface that's secure, and there's nothing else there but the baby. Now, when that comes off, and now you've got the bottom pack and play, usually the problem with that is it's not that comfortable for sleeping for children. They use it more, it can be a traveling thing, but it's not ideal for a newborn or a young infant. So a newborn is a baby that's born until it's 30 days old. And then when you use the term infant, you're talking 1 month to 1 year. But
okay, I didn't know that. That's a good tip. I like hearing my infant for 4 months, or my newborn for 4 months.
Thing, yeah. So again, you're looking at the firmness of what you're using. That's what's the important part, and not putting somebody else's mattress in because baby might be more comfortable. That's where all the safety issues come in. Yeah. Also, when you buy a product, there are now expiration dates. Did you realize there was an expiration date on a car seat?
That's right.
Yeah,
Yep.
see,
That's
you gotta
good.
be mindful of that, because that means that it meets the current standards, the safety standards.
That's great. Good things to know. What about, we received a question, are there any precautions that parents can take if their baby sleeps with a doctor approved, for reflux or what many other reasons, but sleeps with an approved wedge under their crib or bassinet? Like, what are things that you can do to ensure extra safety there?
I think this question should be, directed to the pediatrician, because, the pediatrician would know this individual specific condition of the baby, so they'll be able to recommend, the best practice, for this particular condition.
And physicians will give them directions, because I have had moms call me and they'll say, the doctor said, and then they'll go into the description of it. But you're right. And I always say, you're seeing your pediatrician and you're following their directions. And if you understand what they're talking about and how to put it at a 45-degree angle or whatever the angle is, then that's where we're going with that. And that's good. Always follow the doctor's recommendations.
That's great. That's great. I love that. It's such a reminder too, because no one knows your child
Correct.
better than you and your pediatrician, who are seeing you consistently.
Yep.
So always taking and running everything by your pediatrician is great advice. Well, wonderful. Well, we're about getting ready to wrap up here. You guys have been so efficient in covering this topic so thoroughly. I'd love to know, maybe are there common misconceptions with safe sleep that we don't think about? Because sometimes it does feel like, okay, I know how to do this, but we can be so familiar with something that we can be blind to what we're blind to,
One of the things is parents will say to me, won't the baby hurt itself without the bumper pads?
Right.
And how you walk into some of the places that have the nursery set up with the beautiful bumper pads. No, it's not, the baby's not going to be thrashing enough that you have to worry about that. Always, if you're going to use a crib, again, make sure that it is it meets the standards, the safety standards. I know a number of parents that love antiques and would refinish antique cribs that had slats that were too far apart. And that's dangerous. Mm-hmm. So make sure that your cribs don't have slats that are too far apart. And then when your children are moving, sometimes, yes, they will slip their little leg or arm through the slats. Right. That's not been associated with any damaging effects. They can pull their arm back and forth, but that wakes them up, and up you go in the middle of the night.
They'll let you know if they get stuck.
Who now has their leg stuck in, and you're helping them pull it back. But again, it's a much better choice than putting a bumper pad there that could cause, bad things to happen. Yeah.
That's good. What about circling back to the recommendation you made about the Mailman Center, how you can call and get help with the car seat? Is that only for Jackson patients, or can anyone utilize that service?
Anybody can utilize that service. Awesome. And I've got the number.
Great.
I always keep it on my board, and actually a mom came through today and I took it off my board and handed it to her.
Oh, that's great. Okay, get your pens ready, everyone. This is good.
Yeah, I'm looking. Okay. It is 305 243 9080.
Awesome. Will you say it one more time?
305 243 9080.
That's great. Yeah. That is an incredible resource. We need to share that on Miami Mom Collective, because there's so many, there's families that have 2-3-year-olds who still don't know how to utilize their car seats, or they could be installed inappropriately. So this is a great resource. We also received a question about the placement of the crib or bassinet. Is there a preferred location, like near a window, away from a window, under a vent, away from a vent?
There's actually people that will come to your house. You know how you can hire somebody to do anything?
Somebody for anything.
And they'll to see if you have a safe environment. And one of the things that they pointed out to me, because I talked to them one time, the biggest thing that we tend to do is stick the crib in the corner, because that's just like the way we decorate. And many times they've seen parents that use the blinds that you have a pull string.
Yeah.
So, and you have this little 7-pound baby sleeping on its back, and what harm could that do? Well, in a blink of an eye, those babies are all grown up and they're standing in a crib, and so look in your room, keep the crib away from a window, away from draft, away from anything they can reach.
Yep.
Okay.
That's right. Or could pull on to launch themselves out. Yeah.
Right.
That's good. That's great. Yeah, I know there's businesses that will come and baby proof your house for you, which is amazing. All sorts of things available. So this has been so encouraging. Again, I just want to give a huge congratulations. I love knowing who's listening and to know that we have some expectant mamas, some first time new mamas of little ones is just so encouraging. And again, commend you for doing your research and joining us tonight. Dr. Burbello and Dr. Abiri, thank you.
Thank you.
And before we go, I want to take a minute and draw your attention to just some resources that we have. We've already received the question, will there be more upcoming webinars? Yes, resounding yes.
Nice.
And we have some amazing topics coming for you. We've got, mental health in our children. We've got one coming up in Spanish, actually in 2 weeks from now. So mark your calendar for March 10th. And we're going to be talking about sex education in Spanish. And I say we, but I mean not me. I will not be joining us for this one because you don't want me leading in Spanish, but an amazing expert will be doing it. And that whole episode will be in Spanish. And we have one, I believe, if you go back to jacksonevents.org, we have that also in English. So tons of topics. Again, I just want to tell you, we've got everything from COVID to working with children with autism to nutrition, I think baby feeding and prenatal care and pregnancy, really the whole gamut. So go check out jacksonevents.org and you can watch any of the previous 30 plus webinars. And this one will be there in about a week. And we'll send it out via email so you can pass it on to a friend. But do make plans to join us in 2 weeks at 8 p.m. Where do babies come from? What is a period? Why is my voice changing? Talking to your kids about reproductive health and sex and how do we do that? So that's going to all happen in Spanish in 2 weeks from now on March 10th at 8 p.m. So just thank you so much again to Jackson. Thank you to Dr. Burbello and Dr. Abiri. Here's some great resources if you just want to screenshot this slide here to do more research on your own, to check out more resources related to this topic. But again, thank you to everyone who joined us. Please find us on social media. Jackson Health is there to serve you. Miami Mom Collective, we're here to serve you in your motherhood journey. So thank you so much for joining us tonight. And we hope to see you again in 2 weeks. And I hope that everyone has a wonderful weekend and that your sweet babies will sleep so safely with this amazing knowledge that you've gained tonight. So thank you so much, everyone.
Oh, thanks for having us.
Thank you. Thank you for
Love
having
you,
us.
moms.
Yes, hang in there, mamas. Home stretch.